Hi guys, welcome back to Father and Son Investing, the channel that got started when my wife and I gave our son $100 for his birthday to invest. He thought it was the dumbest present he'd ever received. But then he caught the bug, and then he in turn got me into YouTube. I thought it was one of the dumbest things I'd ever seen until I started viewing YouTube videos and making YouTube videos, and now I've caught the bug. Today we're going to talk about Clover Health. The vote is happening today for Chamath Palihapitiya's social capital SPAC to merge with Clover Health. So hopefully by the end of the day we'll know that this has gone through. Today I'm going to cover with you what Clover Health is, what they do, why their business is important, and why it may be a good investing opportunity for you. Now, to understand Clover Health, first we need to cover some basics about the United States healthcare system. Well, at least the Medicare system, especially for our viewers who do not reside in the United States. So Medicare came about in the 1960s. It's essentially a government payer system for health care. In general, it applies to people who are over 65, but there are people on Medicare who also may be disabled or have other reasons why they qualify for Medicare. But in general, today we're going to talk about the over 65 population. So some things about Medicare. It comes with several parts, Part A and Part B. Part A covers hospital care or sometimes long-term recovery care. And then Part B covers the doctor's bills, labs, some medications, like when you're in the hospital. It doesn't cover medications outside the hospital. All of this requires coinsurance or a copay, meaning in this case it's 20%, and it means that if your bill is $10,000, your portion of that bill is going to be $2,000. And there is no limit to what a member might have to spend out of pocket. It does not cover prescription drugs unless you enroll in Part D. That costs extra for the premium. And there are no supplemental benefits. One nice thing about it is, though, that you can choose any provider you want as long as they accept Medicare. Now let's talk about Medicare Advantage. It also involves premiums for Part A and Part B. And let me just go back for a minute. For Part A, if you have worked for 10 years and put 10 years into the Medicare tax, then you don't have to pay premiums on Part A, just Part B. So Medicare Advantage involves premiums and copays and deductibles and coinsurance. But the member usually have a set dollar copayment. Sometimes those copayments are zero depending on the plan. And so they have some idea of what their final payment will be. They oftentimes will also have a set maximum out-of-pocket limit for the calendar year, and most plans will include prescription drug coverage, so that's kind of nice. Another nicety about these plans is that many of them will have dental coverage or vision or hearing aids, or allow for over-the-counter items, or some even pay for gym memberships. One restriction on those is usually that doctors must be in the plan's network, and those might be either PPO or HMO if you're familiar with those two things. Now, having covered some of the basics, let's just talk about what this particular market looks like. Now, this graphic here really just addresses the Medicare Advantage market. The overall Medicare spending in America, you're looking at about $800 billion, $800 to $900 billion. But the Medicare Advantage part of that market in 2019 was $270 billion, and it's expected to rise to about $590 billion in 2025, with the total addressable Medicare market looking at $1.25 trillion. Now, some interesting things about the Medicare market. 10,000 new baby boomers will be joining Medicare every day in the United States. Right now, the Medicare Advantage penetration is estimated to rise from 36% in 2020 to 50% in 2025, meaning 1 in every 2 Medicare patients will be using a Medicare Advantage plan, roughly within the next 4 years. And really what will be driving a lot of that will be choice. More choice at less costs with a Medicare Advantage plan than with an original Medicare plan. And the fact that it has strong bipartisan support within the United States government. Now, this Medicare Advantage market is mostly run by 7 large companies. They have about 77% of the market share. And we're talking about companies like United Healthcare, Aetna, Humana, Blue Cross Blue Shield, Kaiser Permanente. The remaining 23% is split up among approximately 300 other smaller Medicare Advantage companies. And thus enters Clover. This is who Clover says they are, a next-generation Medicare Advantage solution deploying best-in-class technology to solve one of the world's biggest data problems. That is the crux of Clover's way of delivering Medicare Advantage. They are using technology to do that. So Clover has developed the Clover Assistant. Once a patient is enrolled in their plan and they see a provider who is also enrolled in the plan, this Clover Assistant gets used for every visit for a Clover patient. Now, some of you may be thinking, that's all great, but how are you going to get providers to want to use this system? Well, one of the incentives is that providers using this are reimbursed at 2 times the industry average and at a faster rate, generally within about 4 days. And the reimbursement is fixed. It doesn't go up or down depending on how much data gets input. In just over 2 years since launching the product, they have over 2,000 highly engaged providers who are contracted to use the Clover Assistant. 92% of onboarded providers use the system 92% of the time for eligible visits in 2019. It only takes 1 hour of an onboarding training for the providers to learn how to use this system. And quite honestly, for providers, it's useful. The system provides medication adjustment prompts, 2,000 of which are accepted per month on average, and almost 1 new diagnosis is confirmed per member via the Clover Assistant suggestion. Well, some of you may be thinking that computer system sounds great, but how does it save money? Well, this is a bar chart showing the returning members' MCRs. MCR is defined by them as the medical expense, how much money they're paying out, divided by the premiums that they receive. In green are the non-Clover assistant physicians, and in blue are the Clover using assistant physicians. In 2019, there was 93.8% versus 89.2%. The MCR. Now, if you think about that ratio, the way that you can lower that number is either by paying less or charging people more. Charging people more generally is going to drive away customers, so ideally they want to have to pay out less. In 2020, we start to see that gap widen. We see 93% versus only 82% for those using the Clover Assistant program. Now, where was that 11% coming from? 7% of it was driven by just capturing new diagnosis. A provider then understands or realizes that their patient has something else that they need to treat. 4% of that came from fewer acute events, meaning these patients are not going to the emergency room and they are not needing inpatient admission. So what we know is that providers are paid 2 times the industry average and that they receive their payments faster. You may be thinking, yes, but they'll have fewer visits. Indeed, they may have fewer visits from Clover patients, but that then opens them up to have more visits with other patients. How do patients then get interested in this program? Well, for Clover, the primary care physician copay is $0. That's right, $0. Most competitors, you're looking at $5. And the specialist copay, if they're referred, is going to be between $5 and $20, and you're looking really at more than double that for some competitors. Patients will have a drug deductible, but in general that deductible is less than they would pay with Clover's competitors and far less than the Medicare deductible. And Clover offers almost $350 a year in over-the-counter allowance. If we look at the average annual cost, it's about $1,900 a year for Clover and about $2,260 a year for a competitor. That again is far less than the average annual cost for somebody who is just on regular Medicare. Now, I mentioned earlier that really the Medicare Advantage market was driven by 7 big players. Before you here is a bar chart that shows the market share in Clover's established markets. So Clover was founded in 2012. In 2013, they essentially owned none of the market. And then as you watch the bar chart grow, Clover is in the dark green, you can see how their percentage is climbing rapidly and significantly, such that in their established markets, they've overtaken CVS/Aetna, and they are rapidly catching up to United Health. One important thing to understand about Clover is that really they're not competing in that many markets at the moment. In 2018, they were only in 19 counties. These are primarily on the East Coast of the United States. And in 2019, they had increased that to 26 counties, driving their membership rate from 31,000 to 41,000. In 2020, they had about 50,000 members. As I understand it, for 2021, they already have 100,000 members under contract. Additionally, their market will be expanding. Recently, they have created a partnership with Walmart to provide services within Walmart's clinics in the state of Georgia. Now, with that in mind, let's take a look at their financial results. Obviously, it's 2021 now, so this slide is a little bit out of date, but at the time it was made, year to date for 2020, they had an average membership of 56,500 members. That is an increase of 39% over the third quarter year-to-date results for 2019. Now, of course, their membership is what drives their revenue. So their revenue was $507 million, which was an increase of 46% year over year. Their medical costs obviously went up with more members. When we combine all of their expenses, we come up with an adjusted EBITDA of an $11 million loss. That, however, is also improving. Let's take a look at their projections. They plan to increase their membership by increasing the market share in their existing markets, as well as expanding into new markets, such as I mentioned, them expanding into the state of Georgia. That membership growth is running at about 30 to 40% in their projections. They see their operating expense ratios going from 20.9% in 2021 to long-term becoming around 11%. And in 2023 is when they predict that they will become profitable. Now, here's how this transaction will go down, assuming that the vote by the IPOC shareholders is in favor of this merger. The original price, of course, was $10. That's just the general SPAC price for every SPAC, except for one that I can think of. It raised about $440 million. There is other money coming into this transaction from IPOC as well as from PIPE investors, yielding about $1.2 billion total sources of money coming into this transaction. The enterprise value will be $3.7 billion, and when the transaction is complete, the IPOC shareholders will own almost 19% of the company. The private investors will have 9%, and the IPOC sponsors will have almost 5%. Now let's just take a look at the stock price for IPOC. It started at $10, which is where, again, SPACs start. It took a little bump up when the announcement was made that they were going to merge with Clover Health. During the month of December and running into January, it's gotten up to a high of around 15. And now you can see that in the last little bit, in fact, just today, the stock price has taken a dip. And why is that? Well, during the time I've been making this video, the merger announcement has come and the IPOC stockholders have approved the merger. But this may be a nice buying opportunity. What's my opinion of this company? Well, for the time being, Medicare Advantage is definitely here and it is going to be growing. Now, all of that depends on what the United States government might do with Medicare in the future. And I hate it when people say health care. In my mind, health insurance has nothing to do with health care. Those are two separate entities. What the United States will do with health insurance in the future. But as the plan exists now, we can see again that 10,000 people per day are joining the Medicare ranks, or at least Medicare eligible, and that number is only going to continue to grow. I think that Clover is trying to revolutionize the way that Medicare Advantage is being performed by using technology to drive lower costs, and we've seen how, at least with a small cohort of patients, they've been able to do that. I hope this video was informative for you. If you liked it, please give us a thumbs up. If you didn't like it, well, let me know in the comments section what you think I could have done better. We'd love to have you as a subscriber. And again, until next time, enjoy your investing.